Thanks, Linda. Amy Johnson, you want to hop in?
Yeah. Hi, everyone. Amy Johnson. I'm the director of the Parent Child Center of NCSS and co-chair of the Vermont Parent Child Center Network.
Hi, Pam McCarthy, President and CEO of Vermont Family Network. Glad to see you all.
Hi, Pam. Becca, do you want to try again? And then maybe Julie, CS, you can go after. No. We got to figure it out because we want to hear from you, Becca.
While Becca's figuring it out, I'll jump in. I'm Julie Cadwallader-Staub. It's so nice to see so many of you again. It's a little bit like old times to see your faces. So I'm the development director now at the Stern Center, and I've held multiple roles in early childhood over the years. So I'm happy to be part of the accountability team for at least this meeting. And I just wanted to let you know that I have to sign off at about 10 to 10. So I'm not being impolite. I just have another meeting that I'm the host for. So you'll just see me exit then.
Okay. Thanks, Julie. Who haven't we heard from? Danielle Howes, and then Elizabeth Gilman and Katie Davis.
Hello. My computer's acting weird, so I'm not going to be on camera most of the time, but I'm Danielle Howes. I'm with Children's Integrated Services, and I'm the Part C coordinator.
Thanks, Danielle.
Hello, I'm Elizabeth Gilman. I'm the Help Me Grow program manager at the Resource Hub.
Thanks, Elizabeth. Katie? And then maybe Charlotte after her.
Hi everyone, I'm Katie from Hunger Free Vermont, and as part of my work I support medical providers in doing screening and trying to do it in all sorts of different sectors. I have a bit of a cold, so I'm going to keep myself off camera so you don't have to watch me blow my nose, but I'm happy to be here and it's nice to see all of you.
Thanks, Katie. How about you, Charlotte?
Good morning, everybody. I'm so happy to be here. My name's Charlotte. I coordinate the Patient and Family Centered Care Program at UVM Children's Hospital, and I also work as a consultant with the Division of Maternal Child Health around family partnerships, and currently also part of the contact tracing team. So things are full.
Yes, I'm sure. Well, thanks for being here. And Janet Kilburn, another part of the contact tracing team.
For sure. Janet Kilburn, Early Childhood Director at the Health Department and also doing contact tracing.
Okay, thanks. Anyone else who wants to try their audio or who we missed? Okay. Well, it's great to have you here today. The topic for our meeting today is really around screening, how we're using screening, and then what's the point of screening, right? So I'm going to hand this over to Lauren to kind of give us the big picture. The goal is both to get an understanding of how screening is being used. Both, I think most of us are involved in screening one way or another, right? And clearly it's been a priority in Vermont. Mostly universal developmental screening we've talked about, but now we are talking about social determinants of health and other tools that are being used increasingly. So, and so if we're committed to using them, you know, what's next? What else do we need to work on and be aware of together? So Lauren, do you want to start us off and I can do the screen share?
Oh, it would help if I took myself off mute. Thank you. Yeah, so I think, you know, I love talking about developmental screening, especially with this group, because there are so many fellow champions on this team. And I think that we could have a really productive and strategic conversation. And I get really excited when I think about where, you know, our vision, which is something that we hope to talk a little bit more about today with you all and get some input about what do we want to happen in the state of Vermont around screening. And as Beth mentioned, I think to set the stage a little bit, we do often talk about screening in a specific way. I think before COVID, it was very much focused on what type of screening. And the conversation has shifted naturally, and all of you have been part of those conversations. So I just want to say at the, right out of the gates that I hope that my tone is one where I'm not preaching to you all, because I totally get that we are all the experts in this area. But just to say that we, have started talking about screening at a much more comprehensive level. So I think that that's, again, not a surprise to anyone here, right? So building resiliency, screening for social determinants of health, screening across developmental domains, universal screening, they're all terms that we hope that we can kind of go over today as a group, get some clarity around, because screening is much more complex and it's taken on a much bigger purpose than like just developmental screening or just screening for food insecurity. We're really talking about this kind of comprehensive screening to build resiliency in families and communities. So not an easy thing to tackle. We're certainly not going to figure it all out here today, but we are really jazzed to have all of you as part of this conversation to kind of get us level setted. And now that we have our new revision of the VCAP, ground ourselves in what our role is in terms of accountability and leadership in this team around screening and what that means. So certainly we see this fitting in VCAP goal number 1, right? All children have a healthy start. And so we, again, when we think about the VCAP as a continuum across the lifespan, this also includes the prenatal period, which we know is such a vital opportunity to really engage families and build resiliency by increasing parents' knowledge of child development and connecting them to those resources even before that tiny human has entered the world. And I think Beth has a couple, so we just wanted to review these, quickly. Certainly we see, as I mentioned, this is in goal number 1. You could argue that it also can straddle goal 2 and even 3. And when we think about, families and communities playing a leadership role in children's well-being. And I think that's one thing that I just want to put a pin in and have you all be thinking about during this conversation, because as the Help Me Grow team has been promoting developmental screening across early childhood settings, having family engagement is crucial, especially to developmental screening. And that is the end point, right? Is that we want to really be bolstering families' resiliency by having knowledge of their own child's development, being able to ask those questions, reducing stress in families, preventing child abuse, connecting to social determinants of health so that they can, connecting to human needs, basic needs, so that families can engage in services if they choose to do so. And then we also see this as building community resilience. So we know that if all children have a healthy start, then our community is able to thrive, and we have a prosperous, Vermont. So we can argue that it really spans several of the goals in the VCAP, which again, no small conversation.
Yeah, and so I just put in a few examples of where we specifically call out screening in the VCAP. It does talk about developmental screening particularly, because at least here in the indicators, that's the data that we're collecting, though in the future it could be other types of screening as they become more universal. So this is one of the goal 1 indicators we're tracking, the percent of children who have a developmental screening in the first 3 years of life. And then a few areas where it's called out in strategies. So objective 1 is around parents, caregivers, children have equitable access to comprehensive physical and mental health supports and services. And under strategy 2, we talk about ensuring prenatal to age 8 healthcare services are comprehensive, accessible, high quality, and culturally and linguistically responsive. And we are calling out screening efforts of all types there. It's also called out a little bit later when we're talking about children and families having access to needed services and resources to support optimal developmental and educational outcomes. So I know that you're not absorbing all of this immediately, but just kind of calling out if for folks who may not have explored the updated VCAP as much as I have. So that is all in goal 1, just to ground us.
Great. So I think these are some of the things that we hope to cover today. Certainly, we want to start with some definitions. As I think we saw in our intro today, language can be extremely powerful. And we know that screening is a shared priority across many settings in the early childhood system. And so even more important to have a good understanding of what we mean when we say screening and social determinants of health. We do have some information on some current data in terms of who is being screened and who is screening and where. That is definitely a huge, I think, area for strategy improvement and for our, collective thinking around where we want to go with that information. So we'll share a little bit about the infrastructure that we currently have, and then where we see some key opportunities, certainly that have been elevated as a result of COVID, and some promising practices, which Bev is going to share some work that has been going on in partnership with Let's Grow Kids around screening in early care and education settings. And again, we really want to brainstorm around a common vision. So again, having that shared language, shared vision, and shared messaging so that we as leaders can really be having these conversations in our respective meetings and networks, and really be promoting building resiliency through this comprehensive screening strategy. And I just want to take a quick check. Beth, are you able to monitor the chat while we go through? Because I actually can't see it on my screen, and I'm at multitasking. So I just want to make sure that we're not inadvertently ignoring anyone.
Yes, I will try and do my best.
I know it's like,
just
so far Amanda's getting all the chat time.
We're a friendly crew, so
yeah, seriously, interrupt if we're not noticing that you have a question or you want to jump in. Feel free just to
we know that folks are really familiar with a lot of this stuff, and so right.
All right, perfect. So here we have some just basic definitions to go over. And again, I think, just to make sure that we're all kind of grounded in what we're talking about. Again, I think, especially in healthcare, but as we think about healthcare integration into the early childhood system, there has been a lot of movement and conversation since COVID around what is the role of healthcare providers? What is the role of healers? I think for any of you who are familiar with quality improvement work and Don Berwick, you may have seen his call to action to healthcare providers around the moral determinants of health and the role that healthcare providers can play in advocacy right now. That doesn't necessarily look like the traditional role of healthcare, but really elevating that as, needing to come together. So, we heard solidarity in the poem this morning, and I think that is a key value. And I think it's something that Vermont does really well. So as we're thinking about strategy and being well positioned and how to build our community in the aftermath of this pandemic, and all that has been kind of brought to light, that Vermont does a really good job of taking care of its communities and its neighbors. So, as we're thinking about the causes of illness or the causes of suffering, Certainly we can fix people up in the doctor's offices, but then if we send them back to those communities where there's systemic issues that are just, you know, that are, you know, kind of replaying whatever the issue was that caused that illness in the first place, then what's the point? So we really need to be kind of thinking about that broader systems level change. And then to bring it down a level, we're talking about developmental screening today. Certainly we're also talking about the other screening, but developmental screening gets conflated a lot, as a lot of you know, and can speak to this from personal experience, that no matter what sector we're talking about in early childhood, developmental screening can get confused easily. So when we talk about developmental screening, it is that quick check of a child's development. It's using a formal tool. It can be done by professionals. It can also be done and should be done by families. And just to build onto that, developmental monitoring or surveillance is also recommended by various, you know, oversight and like the American Academy of Pediatrics recommends that developmental monitoring is done at every well child visit. That is not using a formal tool. It is often done using a checklist. In Vermont, we use our Bright Futures guidelines, but you can see where that can be confusing. They're both important. There's a great paper on why both developmental monitoring and developmental screening should be done together. And we can certainly share that after as a resource, but just to kind of, again, ground us in some language. And then the social determinants of health. So this has been a hot topic lately, and it has taken on several different iterations. You often hear social determinants of health. Social conditions of health has kind of emerged as the go-to language. Don Berwick is now coining the moral determinants of health. And you can see where there's kind of, you know, pluses and minuses to the various iterations, but essentially what we're talking about is that those social conditions, those environmental conditions that can impact health outcomes. And again, there's different, you know, depending on which definition you're reading, there's different examples that are given, anywhere from the ones that you see below, I won't read through them, to, you know, isolation and connection, social status. Gun violence is one that's named in a few of the various definitions. So it's really those external conditions that we know influence health so much more than biology. Next slide. Great. So now we're going to talk about screening in Vermont and that comprehensive screening vision that we have. This is just visual. It has its strengths and it has its weaknesses, but it's the best that we have right now to talk about the various settings where screening can and should be happening. So we certainly know that screening would happen in the child's home by family and caregivers. It can also be done via in-home visiting. So we have our Strong Families Vermont nurse home visitors, as well as the family support home visitors who often are using the Ages and Stages questionnaire. We know that it's happening in the pediatric medical home, both developmental screening, mental health screening, social determinants of health screening is now happening, food insecurity screening. And there are some specific recommendations that medical providers have around screening in that setting. But again, families can be and should be completing those screenings as well to give their perspective. And in Vermont, we have a lot of our early care and learning programs and early educators who have come on board. So, you know, private registered homes, licensed centers, parent-child centers are doing a huge bulk of this work, as well as our Head Start partners, pre-K partners. So this is a big area where we know there's some real high quality screening happening. It's also an area where there's some exciting, promising practices and innovations happening. And we know that these early educators have such a critical role in this process. Having that early child development knowledge, as well as having the opportunity to watch children develop over time alongside of their peers, and the trusting relationships that they have with families. So that's not to say that that's not happening in the other arenas, but we know that early educators are coming into the fold in a way that we really want to promote and elevate as a system. So this is my attempt at showing the difference between some of the infrastructure that we have around developmental screening. So as Beth mentioned in the intro, we can be screening, and we should be screening in a variety of these settings. We know, the intervals and the frequency that's recommended for the screening, but it needs to be done in a coordinated manner, and those screenings need to be communicated across those settings to really decrease duplication and ensure that we're not screening in silos. And so this is just an image to show that we have two data management systems in the state right now. We have the Help Me Grow hosted ASQ online system, which is hosted at our resource hub. And we have the Universal Developmental Screening Registry. So I'm going to just give a quick overview about what the purpose of those two systems are and how they interact, to hopefully give us some information to talk about when we talk about strategy. So the ASQ online system provides a virtual opportunity for early childhood professionals and families to complete the ASQ online on a device. So it essentially enables folks to, share a unique link with families if they choose to do so, so that families can complete the screening on a tablet or on their phone or on a computer at their home or in whatever setting they choose over time. It also allows early education providers to do the same, so they can complete the screening virtually, which certainly cuts down on the paperwork burden that we know the ASQ system previously had. And it also allows for easy sharing of that data, as well as management of the own program's data. So in this visual, you can see I only chose to do 4, but you can imagine, and we have several, and there's some numbers that we can share after this of folks who have come on board to the ASQ online system. So it's available to medical providers, to childcare providers, to home visitors, and we're really working strategically to roll that out throughout the state. And then those programs, when they complete that ASQ online, have a connection. So there's a bridge that is being created. It unfortunately, a pandemic will put a kink into all of your best laid plans. Unfortunately, is on pause right now because our IT is needing to focus on vaccine-related issues. But there will be a bridge so that ASQ online system in those various programs will be connected to the Universal Developmental Screening Registry. The registry is where various providers across early childhood settings can access screenings done by their community partners. So all of that information you can see is feeding into the registry, and then those same providers can have access to the registry and see if a screening has been done. The pediatrician can see if a screening has been done by the child's child care provider recently. And the home visitor can see if a screening has been done at the child's medical provider. Bev, I see your hand going up.
Yes, I just wanted to note in the chat that there was a question about, is the ASQ online something that programs need to purchase? Is there a fee?
That's a great question. So Help Me Grow is hosting the ASQ online system. So we are, there is no fee associated for partners who are willing to come on board. So essentially, if you're interested, reach out to me. We have Rachel Wallace-Broder at AVCHIP, who is our partner and our liaison for medical providers who are interested. And I am helping to connect other community partners who are interested in coming on board with Elizabeth and Mike, who are hosting the system at the Resource Hub. Linda, I'm so glad that you asked that question. I'm so glad that you're hearing this. I'm sorry that it's for the first time, but this is why we're doing it today.
So Lauren, it's not a link on Help Me Grow Vermont website. It's something that if we want to be able to access it, that we should connect with you about that.
Yes. So to set up that's a great question too, Amy. So to set up your own program and participate in the system, you'll want to go through us, and essentially that'll allow you to see all the children that you're screening at your setting. There's some data management features around that. The Help Me Grow site does have a link so that families who find the Help Me Grow, through self-referral, right, who find the Help Me Grow website or who are working with Elizabeth or Mike at the Help Me Grow Resource Hub, can access it that way. And so Elizabeth and Mike have access to that program, and they can help support families in that way. And then certainly if anything comes up as a result of that screening, they know how to connect them to community supports and services. But as a program, you would want to have your own program set up.
And
I'm
Lauren,
also, oh, go ahead.
Just saying that there's another comment from Sheila that it would be great for family services workers to access ASQ results for children who are involved in child welfare. Is that possible, Lauren?
Absolutely. That's something, Sheila, that has been on our wish list. We've had some really great experiences working with Peter Cudney, who's doing the training partnership at UVM, and sharing this information with them. But it has been something that we definitely want to offer to any partners who would benefit from, being able to support children's development. So absolutely.
That's great. That's great. I'm so happy to hear that. It's been a long, many years. And when I was in family services prior to just coming to the child development division, we looked at many different screening tools and, in fits and starts. So it would be really great to be able to kind of attach, for family service to attach themselves to something that already exists instead of developing it themselves. I think that potential has more opportunity for success.
Absolutely. Yeah. Right. And so the integration of the developmental screening results from all the various ASQ Online partners into the registry is really where we see a huge opportunity to have that coordination and that communication. And because again, like we know that screening is happening in all these places, and it has been happening in somewhat of silos, right? So we need to figure out a way to share all that information.
Great, thank you.
Well, yeah.
You want me to go back to the screen share just quickly?
This is Amy, and I just want to say I'm excited for the discussion to follow, because as I was thinking through the reflection, questions in advance of this meeting, I was thinking about just a number of the things that just came up just now. But I love the idea. I have never actually, I don't usually put something as a placeholder in the chat, which I think is a great way to kind of tether, if you will, to use the Amanda's word from earlier, tether our thoughts and hold them in place. But I think a lot of these reflection questions are going to get at some of these things, and I really appreciate this update.
Great. Thank you, Amy. Any other thoughts or questions before we talk a little bit about what data we have? Okay. So we wanted to share some of the information, the data that we are collecting through these various systems. Again, we know that integration and alignment is going to be so vital for this to really, take off and really work well. So we know about how many children are being screened in the first 3 years of life. Currently, we can get claims data from health service providers around that information. But you can see, if you think back to that previous slide and you've really kind of conceptualize how many folks are screening and the fact that we don't have a common thread, following a particular child to see how many screenings are being done in various settings, where some of this data can fall short in that, where we're hoping that the integration of data sets will give us a much more holistic and a longitudinal view of if a child is screened in a setting before age 3, how many times are they screened? Did they go on to receive early intervention services? Did those early intervention services result in X, Y, and Z? And so we really see an opportunity to bolster the way that we're collecting and then managing our data in the state. And then on the right hand of the screen there, you can see some updated information around who we have using the ASQ online system right now and how many screens are currently in the ASQ online system. Just to, I think it bears repeating. So the screens that are in the ASQ online system will stay there once we're able to activate our IT team and get that bridge between the ASQ online system and the registry. Those results will walk across and they will come into the registry. So we're very excited to get that completed. And the project is nearly done. Unfortunately, the team had to pivot when it was very close to completion. So we're really hoping as soon as they're able to bring their attention back to the registry that it'll happen very quickly and we'll have an onslaught of those developmental screening results in the registry. And for those of you who are familiar with data and who have heard me talk about this before, you've heard me say that the registry is only as good as what's in there. So we're really looking to build that up with developmental screening results so that the value is there when a provider goes in to see if a screening has been done recently on a child that they're serving.
Lauren, the question in the chat was what was meant by Vermont State, and that's the statewide percentage, right? Like total screens divided by total number of children in Vermont, right? So it's like an average?
Like an average?
Yes.
Okay.
I'm not seeing where that is.
Yeah, it's this
The column on the left?
Yeah.
Oh, gotcha. Yes.
And
right.
Lauren, I got distracted for a minute. Did you say what's the source of this data?
So the ASQ data is from our resource hub. So they're managing the statewide ASQ online data. And then Beth, I think this was from which is the dashboard, right? The Health Department dashboard.
Yes, and printed in Howard Vermont Children and Families. That's where the actual graphic comes from.
Lauren, I should know this, but how long have we had the online system in place and is there an upward trend?
Yeah, that's a great question. So we launched it winter of last year, right before COVID, and we did a very soft launch with a few handful of pilot programs. And then not surprisingly, it exploded over the early spring. And Elizabeth, if you are still on the call and you might know those numbers off the top of your head, but we saw a dramatic increase over like February, March, April. She might have had to log off.
Sorry,
Lauren,
I'm here. I was having a little trouble with Zoom today. My computer also is acting up. Yeah, I do want to just quickly update that the data on the slide is a little bit outdated. To date, we actually have completed 2,476 ASQ and ASQ SE screens. We saw a huge jump this summer with the pandemic happening. So our big days, our big months were really, it started to uptick in July, and then through the summer and fall, we really, as more and more providers came on board, we saw more and more folks using the ASQ. So our kind of hottest months were August, September, and October. And have to do a little math here to figure out our total, but
That's
Um,
great. Maybe you can put that in the chat when you.
I
when-
can, yeah,
that
I
would
can
be awesome
absolutely
to
put it
have.
in the chat for you.
Thank you.
Thanks, Elizabeth.
Lauren, and actually Elizabeth might know this too. So one of the questions that I have when we look at that number is, do we know where these, I mean, you know, but do we know where these educators and practices are in the state? Like, are there pockets that we still need to get to
That's a great
and do a
question.
push?
We do have a visual of that in a couple, I think in a couple of slides to show which early care and education practice programs and some of the medical practices that we have on board. There we go. So these were our pilot programs that Bev is going to talk about through Let's Grow Kids. And we do have, we have been, of course, thinking about strategy in terms of rollout. And we have an opportunity through the Learn the Signs Act Early CDC grant, the Building Resiliency grant, to do another cohort of trainings to programs. And certainly that QI training will include access to the ASQ online system. So Becca, that's the training that you and I have been strategizing around getting pre-K partners involved in as a way to scale up and spread.
All right, I will jump in. Thank you, Lauren. Some of you who predate me and have been around longer than I have working on this know that about 5 or 6 years ago, Lauren will tell me the exact date really doesn't matter, but a bunch of years ago, early care educators started to get trained to do the ASQ as a developmental screening tool in their programs, and we learned that they were interested, capable, and it made a great sense in doing that. We did it in part because we were seeing that not all of the primary care medical homes were screening kids, and we wanted to increase the number of kids that were screened. And so the early care educators seemed like a logical place to go. When we all got together, I want to take us back then the next thing that happened is a few years ago, a bunch of us got together across state departments, and we applied for a Robert Wood Johnson funded project called the Aligning Early Childhood with Medicaid. It was a peer learning group with 7 other states across the country to learn about how better to align healthcare and early childhood education. What it did create was a wonderful opportunity within our state to have a dialogue about what we were already so far ahead of so many other states, but what did we want to work on together? What did we see as an opportunity and a need? And in that conversation came up the reality that we weren't, or our wish, our aspiration between our partners in Medicaid, our partners at One Care Vermont, our partners at CDD, at DMH, was that we really wanted to be able to do more social determinant of health screening, or do all screening consistently across settings in that 3-circle diagram that Lauren showed, across primary care medical homes, home visiting, children's integrated services, and early care and education settings. And so one of the opportunities or gaps that we saw was that we weren't doing food insecurity screening outside of the primary care medical home or the medical setting. And we saw that as a natural sort of fit of, well, if we're doing developmental screening, wouldn't food insecurity screening be a good fit for early care and education? So we started this pilot. We thought, let's try it, let's see. And we worked with our partners at the Vermont Children's Health Improvement Project, who worked with Hunger Free Vermont to institute food insecurity screening workflows into the primary care medical setting. And we said, how can we be as consistent as possible with what they did? And so Help Me Grow partnered with us to provide a similar pilot to test this idea in the early care and education setting. We ended up with we were thrilled that even despite COVID, that we were able to have 7 programs at 8 different sites across the state. And you can see here on the map they ranged from home-based childcare programs to center-based programs, from public to private programs. There's a Head Start provider in there. And we, over the course of, we said, let's in 12 weeks, let's try and do this food insecurity screening. We developed this sort of protocol so that there would be some consistency. And we said, let's try it. How does this feel? We weren't testing the tool. We knew the tool was already a validated good tool. What we were really testing was, how would this work doing it in an early care and education setting? So we're testing the process. 449 families in 5 counties participated in the pilot. And just to give you a description, a little bit more description of these programs, all of them already provided meals to families in some way, shape, or form at their programs. So they were already really heavily invested in this idea of food security. And that in these programs, 80% of the families did have some tuition paid for by the Vermont Child Care Financial Assistance Program. And I love this quote. We learned a lot, and part of our idea was in talking with not only learning about how the early care educators felt about it, but also how did families feel about it. And what we learned is that families that, well, I love this quote that said, families that we serve are struggling and they've learned to trust us for support. We serve a diverse population. Some have never had to ask for help. And so this was rewarding for all involved. So what we heard in our feedback is that families were happy to do it, and early care, we only had 2 families that chose that said, no, we're not willing to participate out of all of the families that were asked. And we found that because it was just a 2-question screener, that the early care educators found it was simple and easy process to incorporate. And a lot of people learned a lot of really good things out of the process. I think we can go to the next slide. I think one of the things that people learned is that, so of the families that said, yes, we'll do it, 79% actually had the screen completed for various reasons. Some families just weren't able to complete it in the time frame. And we had both the parents fill out the form and then, and sometimes the early, the best practice was to do it as a paper form. Each program administered it slightly differently. And 35% of the families were found to have some food insecurity. And I think that one of the things we set up was a protocol. Another part, I think there were 2 parts of this that were important. One is that it was really important to destigmatize this process and to make sure that people were comfortable asking these questions of families. And we really wanted it to be a universal process. We wanted every family to be asked. Well, I think that in the past, early care educators have always monitored families, have always been there if families reached out to them, and have always reached out to some families that have maybe they thought were struggling. But what I think this process showed was that you can't always tell which families are struggling. And when families are struggling, it can change. And so by making this a universal systematic approach, we take away our bias and we also destigmatize being asked these questions, because everybody's being asked these questions. And I think the other thing we were afraid of is that early care educators would say, what do I do when I find out somebody has screen positive? I don't have time or resources or know what to do with that. And we have this, one of the important things to us was to remind people, we've got this Help Me Grow infrastructure. You don't have to know all the resources. You don't have to be the one to necessarily help connect everyone's resources. We've got a system. Your job is to help connect families to the Help Me Grow call center, and we tell them about all the different ways that they can do that, or to go to the Help Me Grow call center and get the information. So we found that in this early pilot, a lot of programs already had access or knew about resources and didn't necessarily feel that that was a struggle for them to help connect families, but they did appreciate the opportunity and did recognize that sometimes they were surprised when they asked families about who might need services. The other thing I will say in response to Charlotte's question is, one of the things that we did is we jumped into this. Charlotte asked, did we talk to Keith Robinson at the University of Vermont Medical Center, who is their population health officer for the Children's Hospital, and he is doing a lot of work around food insecurity screening across locations within the Children's Hospital, both inpatient and outpatient settings. And one of the challenges we had is we didn't really have any good way of collecting data and sharing that data with primary care medical homes. But we decided that it was important just to get started, to see how this process worked, to see how it felt, to see what we could learn from a small pilot. But we do recognize that, you know, in the ideal world, we would have a way of sharing this information with our healthcare partners. So Keith, we did talk with Keith a little bit about, could he think, you know, as he was building in, I don't know, future epic changes, you know, what would be some opportunities for how we would make those connections. But at least we wanted him to be aware that early care educators were doing this. We wanted his input into the process, and he was thrilled that we were doing it. He thought it was a real positive thing to screen and to offer it, recognizing that people's needs change, and that different people are comfortable in different settings talking about challenges and issues, and some might be more comfortable in this setting. So he was supportive and aware of this work, Charlotte. So thank you for bringing that up. And I think there's more opportunity to work with them going into the future. So I think that's it for now. And are there any questions that have come up in the chat, or I'm glad to take questions now.
There was one from Danielle, if there was any training for providers. You said that many of them, you know, knew of what resources, but in the ideal, would there be training?
So what we did is that Help Me Grow and Hunger Free Vermont, Katie, I think you're on the call, worked together to develop a protocol with Let's Grow Kids, so that protocol was sort of consistent with what we learned also from VCHIP when they were doing, you know, Hunger Free provided similar sort of work with the working with the primary care medical homes. So we did offer a protocol so that there was sort of a consistency, and so people felt comfortable. And in terms of accessing resources, our protocol really guided people towards using the Help Me Grow resource as much as possible, because they had the most up-to-date information always and could connect people not only to food pantries, but to other, maybe help them sign up for benefits, et cetera. So, you know, like maybe SNAP or other opportunities that maybe each individual program might not be aware of or as up to date on. So the idea was really to help also get people to use that Help Me Grow Resource Center and that infrastructure that's there, and not rebuild it.
Awesome. So there's more questions. I wonder if I share this one last piece, and then I'll pull the screen share down, or the slide share down, and people can ask these questions. So let me just share one more piece that in effort to really to do this well, right? We don't want to just do screening because we are told to, or you know, with that disconnect, really. So in the discussions with Bev and Lauren, I tried to pull together, similar to how we wrote the child, you know, vision around the child is what's the vision? What's, you know, do we have a common vision around how screening can be done well in Vermont? And so I wrote up something as a draft for you all to respond to, and I think we'll build on it based on the discussion. So let me just share these characteristics of successful screening efforts, where healthcare and others working with children and families increasingly recognize their role in identifying and addressing a family's food and housing needs, in addition to efforts for earlier identification of a child's developmental delays and referral for early intervention. Relationships matter. When done well, families have a relationship with the provider and participate in the process, followed by professional guidance and referral to connect with supports they need. Screening is done with respect and cultural humility. By screening practices being normalized and universal, less people fall through the cracks, bias is limited, and the conversations are destigmatized. Screening is an integrated part of workflow, whether in a medical practice, childcare, school, or other setting, and is regularly scheduled, 3 under 3 for child developmental screening and annually for social determinants. Healthcare and early childhood partners share responsibility and are thoughtfully coordinated, able to share data and use screening to follow up as a tool to support child and family outcomes. So I'm going to pull that down and invite folks to share their reflections. Both we can take questions on these efforts that Lauren and Bev shared, as well as respond to this vision and kind of in our effort to identify where are there still gaps and opportunities.
I have a question about the last slide. So Lauren, I think, or I'm not sure who it was, but somebody noted that, I guess it was you, Bev, that a number of programs, I think, was it 8 sites and 9 programs or something like that, participated in the food and security pilot, and noted that many of those programs, or the folks in those programs, didn't seem to really need the information about the resources. I don't know if I heard that correctly, but I did want to say that it's important to think about how that sample was recruited. Those programs may not be representative of programs across the field. I don't know, I do know how they were recruited, but I wondered if you could just speak to that. Because I think programs across the field, perhaps at differing levels of quality or longevity in the field, really might not know about those resources.
Yeah. Well, Amy, I think you're right. I mean, I think for this first pilot, for what I call dipping our toe in the water, we made the Aligning Early Childhood with Medicaid work group that looked at this. And Amy, I think we invited you, that you were part of that conversation too, but we really wanted to work with programs that had the capacity to do this. And we wanted to be sure that we were working with programs that were sort of already able to do it, because we recognize that not every program might be. And what we wanted to learn was, does this work? This was a first step in it. But I think you're right. I mean, ultimately, I think the goal is to build this into best practice for all early care and education settings, programs.
I just wanted to share that context for the data. Yeah.
That was also something that in the conversations we were having with the providers, we had some community of practice conversations, and that was something they highlighted. We talked a lot about, what kind of advice would you give to other providers who kind of maybe stepping into this for the first time. And they all, like the majority of them, recognized before we even asked that they, the group that we had around the table were, they had a lot of institutional supports that they were already providing to their families. And so it was easier for them. And I think this next cohort of folks is a little bit broader that we're looking at, but
Great.
That was definitely something that they were really concerned about as well. And wanted to make
I mean,
sure that
I don't know who we ended up with in the end exactly, but I know that we were talking about Strengthening Families grantees and folks that Let's Grow Kids had worked with, et cetera, and for example, the Strengthening Families grantees are all 4- and 5-star providers.
I mean, a large bulk of them, like just in conversation, they were like, this is easy, like we're already talking to families about this. I think there was a few for whom it was kind of a new endeavor. And so it was nice to have the support of folks who had been doing it for a long time and really had, thought through some of the systems. So it was definitely a wonderful learning experience, I think, for all of us, but that was a piece that we had a lot of conversation about as well.
Can you remind me of the screening? And maybe you mentioned this, what was the tool that you used? Was it the 2-question?
It was the Hunger Vital Sign, yeah. So those 2
Yeah.
questions, having you like reflect back, one about worry and one about actual scarcity.
Okay, that's what I thought, but I didn't, just want to make sure. The other piece that I was thinking about was if kind of where folks are being funneled into is Help Me Grow, then making sure, I know that we talk about Help Me Grow is a really great place for families to call because they know all the resources and it's accurate, that hasn't always been the case in our region. That's not always what we find. And so how are we making sure that providers across the state are interfacing with Help Me Grow to ensure that that information is up to date and accurate, and that there's a system and a plan for that? And it's not, because stuff like, just think about parent-child center, my parent-child center specifically, we add things all the time. We change groups, things change times, what we offer, new grants coming in. So it's really dynamic. And I think a lot of programs across the state are very dynamic. And so making sure if somebody does take the step to call to get the support, that that information actually is up to date and accurate.
I can actually speak to that. It's Elizabeth. So one of the nice things about Help Me Grow is the partnership with 211, which is their database. Their database does follow certain guidelines, and we have some flexibility as Help Me Grow because we're sort of a database within a database. So we have always, and I continue to strongly encourage anybody in your region, if you know that your agency is doing additional work that maybe is not being listed through the resource team at 211, to please reach out to myself or to Mike Bracafort, who is also at the Resource Hub, to let us know so that we can gather that information and be able to share that with families. If we don't have that information, if no one's funneling it to us, then we can't really share that with families. So we are always happy to take that information in. If you know that that's not necessarily in your database listing, and that there's maybe some even temporary things, that's one of the struggles that a lot of times folks have, is they may have a changing program that maybe changes times, or it's grant funded, so they know it's going to be more like an 8-month or a 6-month group. Those are the sorts of things that we strongly encourage people to call the Resource Hub directly and let us know about. BBF has, as a good example, has a Google Doc that the regional coordinators update for playgroups, because playgroups can't really fit into the database. So we have this sort of additional resource through BBF that we're able to use for playgroups with families. And those sorts of situations, we're always trying to be flexible and nimble about. So I would just encourage everyone to give us a call and let us know if you know there's something that can't be listed or isn't listed that you want us to know about, so that we can share that.
And Elizabeth asks for clarification. When you go to the Help Me Grow website and you search for a resource, is that the Resource Hub database you're referring to, or is there a more robust one that you guys have behind the scenes?
That's a good question, Amanda. We actually don't have our resources listed on the Help Me Grow website. Vermont 211 lists their resources. We have a database within their database. So some of those resources that we have are listed on the 211 database online, but ours is much more expanded. And so the ones that are specific to Help Me Grow are not listed on their online database. So it might be best to give us a call.
One of the pieces that I was thinking about in the pre-reflection of the vision statement was, it's really awesome, and having been on that VCHIP program with Lauren, it's really awesome to have all of this work around screenings and training and preparedness and all of these pieces. But I think there's also this huge component of, as Linda said, like, this is the first time she's hearing about this online, program opportunity. There's this huge sector that I run into as the kind of sitting between public and private programs, of people who don't know kind of the process, right? So they hear there's something called screenings out there, but they don't connect it with the further EI or, EEE kind of system. And so there's this gap in knowledge that's a barrier for the conversations with families about why we should universally screen, and or when there's an issue, kind of how to get into that track. So I just wanted to put that out as a kind of placeholder comment.
This is Scott. I wanted to weigh in on the draft vision. Assuming that this is a broad vision for the whole system, which I assume it is, it seems limiting to only use the words food and housing needs as we think about determinants of health, which are much broader than that. I know at Dulce, we're doing some very comprehensive screening, including intimate partner violence, income, maternal depression, and so on. So I think thinking about that language is important. And then the other thing, in two places, it starts off by referring to healthcare and others working with children and families. And then down below, it talks about healthcare and early childhood partners. That seems restrictive to me as well. And I'm not quite sure why the emphasis on healthcare. I mean, I get that they're a big player in all this and probably see universally more children than everybody in some ways, but there might be some language that's more inclusive and probably should be parallel structure in the first and second paragraph.
Noted. Absolutely, Scott. Other reflections on what opportunities, where do we need to head next?
It looks like Janet and Linda have their hands raised.
Oh, okay, go ahead. Linda?
Yeah, I have lots of thoughts on screening, and some of you have heard these thoughts before. I love, I get how important it is. We screen here, we do the ASQ as well as the SE when needed, and we also collect a lot of other data. And so kind of my initial thought is, where is that stopgap? I just feel like there's so much that gets piled onto our plates as far as screenings, and we do we have to do the immunization report, and there's other data that we have to collect, and there's all this data that, with universal pre-K, we had to start collecting different data, and many of us do the food program, and that's another whole set of data, and all of this takes time and resources, and we are constantly the low men on the totem pole. And where does that time and resources come for us to do all of this well? I'm not saying that I don't want to do it, but it's just it's an enormous task with so little amount of resources to do it well. And when it comes to the ASQ, I've been hesitant to do the registry because quite frankly, I don't have time to do it. And I know that one of our local PEDS office, because I take my daughter there, they don't use the ASQ. The other one does use the ASQ, but anytime we have had a concern and that it shows that concern on the ASQs that we do, and a parent takes it to the doctor's office, the doctor office just completely dismisses any of our concerns. And it defeats my teachers. They're like, why are we doing this? If they're going to go to their doctor and their doctor is pretty much going to say they don't know what they're talking about and there's no concerns, then why are we taking our time to do this? And I know in Addison, we are working on those relationships. We had an amazing meeting with the PEDS, local PEDS, a few weeks ago, and we're working on building that relationship. But it's still really disheartening, and it makes doing this work harder. And yeah, so that's that. And then I want to talk to somebody, and I don't know who the right people are to talk to about. I feel like there's this, the relationship with Help Me Grow in Addison County is fractured, and I want to work on repairing that. And the fact that, so much of this is based in Help Me Grow, and that I'm involved in so much, and still this is the first time that I've heard about this, is really discerning to me. And I want to make sure that we are getting the information we need to get, and that resource, and we have some strong opponents to Help Me Grow in this county, but I think it's something that that's a relationship we need to repair, and I'm happy to help with that. Sorry.
Janet, do you mind if I jump in real quick before
Yeah, please
you
do.
go?
Yeah, please do.
So, Linda, I just want to say thank you for having bringing that courageous conversation forward. I think you brought up two really important points that we need to be thinking really hard about as leaders on this team. I think the first being the opportunity in the system right now. And one of the things that we need to strategize around, and Beth, if you don't mind pulling up that vision statement again, it's something that we have been wrestling with. I mean, to be completely transparent, down at the bottom part of the vision is that our healthcare and early childhood partners, which Scott, I totally agree that language needs to shift to be more inclusive, share responsibility and are thoughtfully coordinated. Pause. Early childhood partners share responsibility and respect. And that is something that we need to address as a system and as leaders if this is ever going to work. And I think, Linda, you raised so many points around, the value that that early educators bring to this system. What work needs to be done around elevating that value, around elevating the professional relationship across sectors, around elevating, around creating respect. What would that look like? What do we need to do? And then at the system level, how are we supporting the various the diverse professionals that we know are engaging in this system? And that has to look like policy change. There has to be, a shift to acknowledgement that what is happening in early care and education settings within the early childhood system around building resiliency and screening has to be recognized, both by funding, by professional development. We have been fighting for years to get the developmental screening and comprehensive screening trainings to sit somewhere at the system level. We're piecemealing this, and that is not a sustainable model. We know that there's piecemeal funding coming through that's allowing for training opportunities, but it's not consistent. It's not strategic, and it's certainly not always, it's not sustainable, and it's not always strategic, right? So we have these kind of flash in the pan opportunities where we're able to do this really exciting work, but we're not able to scale up and spread because we don't have a consistent system level support for that. We want to bring quality improvement rating system on board. We want to have the support of the professional development system. And I think those are the things that we have to move forward as leaders. If we all agree that this is valuable and important work to our communities and to our families that we're working with. And I think that's one of the huge calls to action for our team, which again, I don't minimize that as being a really big lift and really hard work, but I think we've got the right people at the table.
I wonder if I might add to that. Thank you, Lauren, for raising that concern. So I actually had almost exactly this conversation with my the two people who are now in my unit. And so one is my supervisor, Ray, the other is Lynn Robbins, because I wanted to bring to this conversation, I wanted to truly represent CDD and not just talk about, this from my lens. And so my colleague Lynn and I, she and I talked about the PPD committee, talked about the process for around training and for getting trainings into the system, talked about the limited funds that we have and all the requests for different kinds of training, and talked about the importance of having VDH at that table. And we would like to see VDH and CIS, and, because let's be candid here, depending on where the legislature goes with, the governor's proposal and all of that, CIS may be part of VDH at some point, but certainly these two entities work very closely together. We would like to see, folks, VDH and CIS continue to work within the parameters of the system that we have set up to provide these training opportunities on developmental screening. There is a will to have it happen, but there are limited funds and there's a process to work within. So, maybe my specific question to Lynn was, is the PPD going to be soliciting feedback on training topics? And she said, yeah, very soon. So we should set up a meeting. We should, talk this through because, the PPD committee within their process could put training related to developmental screening that is, shared with the sponsors as a requested topic. But the way that the system works, someone needs to basically own this training and offer it. And that's all I have to say.
Thanks, Amy. So certainly identifying areas that we need to institutionalize this work. Right now, it has been offered on soft money. Janet, you've had your hand up, and Kate, you have your hand up as well. Janet, you'll have to unmute. Oh, we still can't hear you, Janet.
Okay, sorry, can you hear me? I'm sorry, technical. Okay, hey, thank you everybody, your comments. Scott, if you have more inclusive language that you use in Dulce, please send it to us. Linda, thank you so much. And we will definitely work with you to build that relationship in Addison. Thank you so much for that offer, really grateful. And I just wanted to say about the vision, what struck me as missing from that vision is talking about helping parents really understand early child development as early as possible. Obviously, during pregnancy, prenatally, when parents really understand milestones, developmental milestones, and particularly social emotional milestones. And that's where that ASQ SE is so critical in helping parents understand how to nurture that child's development and start to really understand what that child, how social and emotional skills develop and how parents can better nurture those, because we all struggle with that. It's like we don't have education in our society about what young brains really understand, cause and effect, etc., how important imitation is. And I just feel like that screening tool lays a foundation for early childhood mental health and family well-being, because it really pulls parents into that conversation, and particularly in partnership with childcare providers, because they're experts, or pre-K early educators are experts in this and can really help guide and support parents to avoid behavioral issues, power struggles, even some tantrum. I mean, tantrums are normal, but just really get kids on the right track and also catch those behavioral or kind of mental health challenges as early as possible. And that's autism as well. So I would just kind of pull that out in addition to development. And we have language around that. And I think that's all I wanted to say. This is such a dynamic conversation and meeting. Thank you all for your engagement and commitment to this topic. And Lauren, I didn't know if you're going to mention how the ASQ now has a social determinant of health free screener as well on the website that's beyond just the food insecurity. Scott, if you haven't seen that, you should take a look at that. We're just starting to kind of pilot that with partners. Oh, the last thing I will say is, Linda, anybody, if you have a bad experience with a pediatrician in the state, please reach out to Lauren or myself, because we work very closely with the Vermont Child Health Improvement Program and AAP leadership. Dr. Brina Holmes, who of course was at the health department, is now at BCHIP, because we have partners who can reach out to practices and do a little quality improvement work. This is a common thing we hear. It's been a 30-year paradigm shift from wait and see to no, let's get some intervention in there as soon as possible, even if it's language stimulation activities, right? And sometimes home visitors can do that, not just early intervention, even family support home visiting or nurse home visiting. So please reach out to us, and we you know, we don't even have to know the name of the pediatrician, but or family practice doc, but if we know the practice, we can try to proactively do a little quality improvement work, because that's our charge at Help Me Grow, as well as all this kind of more direct service work is really working with every sector for quality improvement and best practices in developmental, social, emotional, and now social determinant of health screening. Okay, I'll be quiet. Kate, you can go.
Thank you, Janet. Kate, you have the last word.
I don't know if you want me to give me that. Hi, everyone. I do want to apologize. I did get on late, so I did miss the early portion. I do apologize for that. But I'm so happy. The topic of today was screening, near and dear to my heart. We have to do a better job with it. Absolutely. I'm in agreement with all that's being said here. Amy, I'm going to tag on what you were saying, that you with CIS and the Department of Health, please include the Agency of Ed. I will come to those discussions. We really need to highlight child find efforts in this state. We need to compile across federal statute, state rules, where it states that screening is necessary, right? Child find and education is huge. So we all know that, and Janet, we've talked about that quite often. So I think we need to compile that, and unless someone already did, I don't know about it, but across the different federal laws, statutes, and rules, I think we need to compile where it is that we find universal screening efforts, what states should be putting in place, and like Head Start, they've got, you know, their own rules, right? So we have to pull those together in a concerted effort to really, really push this forward, that this needs to happen in a consistent, concise manner. With reorg, you know, this can be, you know, this will be topic of conversation. Where do things lie? So it's a really good time to do that. So just wanted to put that out there, that it is broader in a sense that it reaches so many, and we just have to do a better job at it. And we've done, the infrastructure is there. It's getting better, it's getting better, but we still have some ways to go here. So that's all. Include me on those discussions, please. So thank you.
Thank you, Kate. It's great to have you here. Well, I think we could continue the conversation, but we are at time. Right? So thank you all for joining. I think the point of this conversation certainly was, I was not expecting how much information sharing was going to happen, that people were, you know, in terms of new stuff. So that is fabulous, as well as to inform strategy and vision. Your notes on, you know, to inform this shared vision. I'll take another work around and send out for folks to look at. I just think it's important to be able to have a common vision for us to work towards and to identify where those gaps are. So we hope to kind of continue a similar vein of theme for a February meeting around promising medical practices. As Lauren said, that VCHIP has been working with medical practices on QI work, so to dive into that a little bit more. And then Amanda Biggs and I are working on a meeting around substance use disorder and some of the work that Chittenden County and Franklin Grand Isle have been doing in particular for our March meeting. And then we will focus on food security and some of the work that Cynthia Green has been doing with farm to early care work in April. So that's our plan. Any last reflections? It's great to see you all. Okay, take care. We'll see you soon.
Thank you.
Thank you, everyone.